Alright, today we're going to be hanging a mini bag. We're going to administer the medication through the IV and add the medication into the mini bag. So the first thing we're going to do is we're going to check the physician's orders and the MAR, which are right here. So for the patient, the doctor has ordered Flagyl, IV 500 milligrams every 6 hours. So it is used to kill anaerobic bacteria, and the purpose of the antibiotic is a bactericidal. The recommended is also 500 milligrams every 6 hours. So the side effects include superinfection, dizziness, headache, meningitis, and some of the contraindications include hypersensitivity during the first trimester of pregnancy, hepatic impairment, and some of the nursing implications are to obtain specimens before therapy, monitor intake and output, and assess the IV site for phlebitis. So the first thing we're going to do is check the MAR also. So that's that. And then we're going to get the bottle of Flagyl right here, which it is 1,000 milligrams per milliliter. So we're going to administer, So we're going to go ahead and do our calculations right here. It is 1,000 milligrams per milliliter, and we need 500 milligrams. So we're going to do 500 milligrams X. So we're going to administer 0.5 milliliters of the Flagyl. And I'm going to go also ahead and calculate the drip rate, which is right here. And look at the package, which is 10 drops per milliliter. That's the approximate. So it's going to be running at, it's a 100 milliliter mini bag. And we're going to go over 60 minutes times the drip factor of 10. Gives us about 17 drops per minute. So that's good there. I'm going to go ahead and wash my hands. Wash that, we're good. So now we're going to go ahead and drop the medication. Let's see. So for this purpose, we already have this hooked up, which we don't have a cover for it, but if we did, it would be still sterile. So this is still sterile because it has a cap, and this is also a sterile syringe. So we're going to go ahead and I'm going to go ahead and pull half a milliliter up of air. I'm going to go ahead and take my alcohol pad, and then I'm going to cleanse the top of the vial, just to make sure it's clean. Dispose of that. I'm going to take this off. Go ahead and stick this in here. I'm going to go ahead and inject the 0.5 milliliters of air into there. And I'm going to pull the 0.5 milliliters up. I'm going to go ahead and make sure all the air bubbles are out to ensure that is the correct amount. That's good. I'm going to take this off. And normally you would never recap a needle, you would dispose of it in the sharps, but for this purpose I'm going to go ahead and just scoop method, and then take this off. That can go in the sharps. Then I'm going to go ahead, this is a brand new needle, so we're going to go ahead and banana peel that right there. This is sterile, this is sterile. I'm going to go ahead and put that on there. So we're going to, this is ready to go. So this right here is the mini bag that we're going to use, which I'm going to, once again, use an alcohol swab to cleanse the site right here and clean that off. I'm going to dispose of that. So now I can go ahead and take this all apart, or take this off, excuse me, throw that away. It's a cup. And I'm going to go ahead and inject the medication into the mini bag. This is 0.5 milliliters. Go ahead and take this off. I'm going to go ahead and dispose of that into the sharps. I'm going to mix this a little bit, just to make sure that the medication is diluted in there, right? So next I'm going to have to put the medication label on, which you're going to want to go ahead and put that on there. You're going to put the dose, the route, the drug name, the time. You're going to put your initials, patient, and the room number. So that would be good. Put that all over there. Then next you would want to prepare your tubing. So this tubing is the tubing that we're going to use. It is 10 drops per milliliter. So I'm going to go ahead and take this out. And it is, let's see, this is usually on here, but since we already used it, it came off of this end, which this would be a sterile end, so this would still be on here technically. So I'm going to go ahead and take all this apart. Just open it up a little bit. There's also a cover on this end, which means that that is sterile also. Going to ensure that there are no tangles or anything. I'm going ahead and clamp this off so none of the medication runs out. I'm going to clamp that off also. So this is good to go. I'm going to go ahead and take this off, dispose of that, and it's going to go into this end right here, the blue end, so I'm going to take that off. And then I'm going to go ahead and spike that, which it has already been spiked, but I'm going to go ahead and do it again. All my clamps are closed so it doesn't run out. I'm going to flip it over. I'm going to prime it up to about, there's a line here, so it's about a third of the way up. And then this is a tubing, so I'm going to also label the tubing with my initials, the date, and the time, so that it can probably be changed when it needs to. So that is good right there. I'm going to dispose of all the unneeded supplies that I have right there that I've already used. So I have my gloves, my medication, mini bag, tubing, my doctor's orders. So I believe I am ready to go in the room. And I also have, that's good, okay. And then you would also normally drop 6 milliliters of normal saline in order to perform your ASASH, which is aspirate, saline, administer the medication, saline again, and heparin for, you can only use the heparin if it's a PICC line or if the doctor orders it. But for this purpose, we have a pre-filled syringe of saline right here, so we can go ahead and use that to take a little bit of time. So I'm going to go ahead and gather all my supplies right here. Got that. Take my doctor's order to the MAR. We're going to go ahead and go into the patient's room. So I'm going to knock knock.
Hello?
How are you doing today? My name is Eric and I'm going to be your nurse today. Could you please verify your name and date of birth for me, please?
Alex Rodriguez, 11/23/92.
Okay, awesome. And could you tell me if you have any known allergies?
No known allergies.
Okay, so everything checks out. I'm going to go ahead and check the doctor's order and the MAR once again, just to make sure it matches the patient. I'm going to explain the procedure, which we're going to be hanging a mini bag for you, and it has flagyl, which is an antibiotic for you. It was ordered by the doctor, so that's good. I'm just going to go ahead and put this up here for now. And before I do anything else, I'm going to go ahead and wash my hands, perform hand hygiene, and put on my gloves. Put that on. I'm going to inspect the IV site for any redness, any tenderness, any phlebitis, edema, or anything of that sort, just to make sure that the vein is still good and still patent. I'm going to go ahead and give you a little feel right there. No pain or tenderness right there. It's not warm to the touch. There's nothing visible that looks wrong with it. Make sure it's just clamped already. So now I can go ahead and start to take this apart. So it is already 17 drops per minute that I set the machine to, so that's good. And then make sure there's no infiltration. We're good. I'm going to go ahead and wipe the site. I'm going to cleanse the site with another alcohol, just to make sure it's clean. That's good. I'm going to go ahead and grab my mini bag. This tip is on there so it would still be sterile. I'm going to go ahead and take this off. You can dispose of this. And then that's already alcohol swab. And then so now I'm going to perform my ASASH. So first, let me put this back on. First, I would use the ASASH method. So I would aspirate first after I cleanse the site with alcohol, which I already did. I'm going to go ahead and connect this, which is normal saline. I'm going to go ahead and open up the right there. Going to aspirate. I'm going to go ahead and aspirate. I see blood return, so the vein is still good. You're going to push about 3 milliliters in using a push-stop method. Push, stop, and push, stop. Applying positive pressure, I'm going to re-clamp this. So that's good right there. I'm going to go ahead and take this off. So that's ASASH. And then this would still have a cap on it technically, or a new one. And then I would now go ahead and connect the mini bag to it, which I would take this off. I'm going to go ahead and open up another alcohol swab, clean the top of the port one more time. I'm going to go ahead and connect this. I'm going to go ahead and unclamp this one right here. And I'm going to go ahead and unclamp this and unclamp the roller clamp and watch for it to drip, which it should start dripping soon. Alright, so you do see a little bit of drip. And then you would let this run. You would inspect the site just to make sure that there's no phlebitis or anything like that, and that the medication is actually going into the vein and not the surrounding tissue. So you would let that run, and then you would inspect it. So I would take my gloves off, because this part is over. I'd take my gloves off, wash my hands before hand hygiene, and we're going to say that 1 hour passed so that the medication should have ran through. So we're going to go back into the room, inspect the bag to make sure that all the medication ran through, which it has, and then I'm going to inspect the site again. Inspect the site just to make sure that everything went through. There's no edema or anything around there, and all the medication is gone. So we're going to go ahead and clamp this off right there. Go ahead and clamp the mini bag off in case there is any little bit left, which there shouldn't be. You can clamp this off. Now I'm going to go ahead and disconnect this. And I'm going to finish my ash. So this is good right here. I'm going to take this off. Right there. So you can alligator clamp this in order to use the tubing later, but for our purposes we're not going to do that. So I'll put that. So we are going to finish our ash method. So once again I would have to do the saline. So I would take another alcohol swab. This is a brand new flush, or you could use it from earlier. So I'm going to clean the port with that right there. Alcohol, dispose of that. I'm going to once again plug this up. I'm going to do the push stop method with about another 3 milliliters of saline. So push stop, and push stop. Applying positive pressure, I would reclamp this and disconnect that. And then dispose of all my unused supplies into the trash can. So that's good. Now I would document all of my findings. I would document the dose, the route, the medication, the intake and output, and the drug administered, and just verify that with the MAR. And I would check one more time for the condition of the IV site, which it still looks good. The vein still looks like it's open and patent, and it doesn't look like there's any phlebitis or any edema around the surrounding site. And I would make sure the patient understood what was happening, and that would be it.